with a very big round of applause. Please, let's welcome Mrs. Perpetual Ofori-Ampofo.
Lots of great experience. A round of applause again. Lots of experience.
I'm a medasi. Medasi baby, why? Unity. 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 Why are you hungry this morning? I hope you've been able to take in something. I'm not feeling the vibes. Unity. Unity. Cho boy. Yeah. Today is our day. We must be happy. We have the challenges, our personal ones, the professional ones. But as for today, let's throw them all away and enjoy the day as we can. Dasibre Kwekubuating, the third paramount chief of New Jabin traditional area, a chairman for today's occasion, Nana Yama Kwaba, Wahimfu Mudi Wechinina, Yamamunina Kwaba, Yadamase Samaba Boechi, Yenim said you may be answering a baby and BBIFFF. We thank you so much. A special guest of honor, Honorable Kwabena Minta Kando, who couldn't make it here today and is represented by Dr. Anastasia Yurinchi, Director in charge of traditional and alternative medicine. Our guest of honor, Honorable Nana Oye Bampo Ado, our dear sister and friend. We've had you in a number of our previous events, and we are happy to have you here once again. We thank you for heeding to our call. And of course, she's the Deputy Chief of Staff, Office of the President. Our keynote speaker, Dr. Joanna Ajiman Yeboah, Head of Nursing and Midwifery Services, International Maritime Hospital, Tema. It's good to have you here with us. Thank you for coming. We also have Alhaji Dawuda Brahima. It's actually Alhaji Dawuda Ibrahim Brahima, Chief Labor Officer, Ghana, our special guest. Our registrar of NMC, Rector, Ghana College of Nurses and Midwives, our Greater Accra Regional CNMO, principals of Nursing and Midwifery Training Colleges here present, managers of our health facilities, especially our quasi ones, 37 Police Hospital, and all the private ones, our distinguished invited guests, NEC members, National Council members, our dear nurses and midwives, mainstream media, our own GRNMA media, ladies and gentlemen. It is my pleasure to be here to give the welcome address as president of our association. And as we commemorate this International Nurses Day, we take the opportunity to celebrate our nurses for their hard work, dedication, and sacrifice exhibited across Ghana, from the lowest level of the CHIPS compounds to our teaching hospitals. In fact, we come in various shapes and sizes as nurses and midwives. We work in different settings. Our nurse educators, our preventive health care nurses, clinical care nurses, and when I talk about clinical care nurses, I mean emergency nurses, perioperative nurses, critical care nurses, ENT, ophthalmic, and all the rest. And of course, our researchers, your contribution to the Ghanaian economy cannot be overemphasized. The effort of each and every one of you is what holds the health system of Ghana. You deserve a space that is safe and provides a motivating work environment where equipment, logistics, and medicines are readily available and allows you to practice at your optimum and ensure positive patient outcomes. Today is your day. Smile and be happy wherever you find yourself. If you are in this hall or you are online on Facebook or on YouTube, I'm telling you, put a smile on your face because today is your day. Do not allow the challenges we are facing to obstruct that happiness. And I think this morning on my Facebook post, I posted that if you know a nurse out there, it wouldn't be bad at all to give that person a gift today because today is our special day. So for this year's International Nurses Day, we add our voice to the global voice of nurses and midwives and call on our policymakers, our governments, our employers. And we want to highlight how crucial it is to promote nurses' health and wellness. Because this year the emphasis is on how important a healthy nursing workforce is for providing high quality care, improving healthcare systems, and increasing economic resilience on a global scale. So the global theme, as developed by the International Council of Nurses, the global voice of nurses, for whom we are a member, a proud member, the global theme is caring our nurses, our future. Caring for nurses strengthens economies. We have also tweaked it a bit. And for our local context, we are saying nurses and midwives are future. Caring for nurses and midwives strengthens economies. So yesterday, we held a nurses cafe. I'm sure majority of you listened to it online, on Facebook. I listened to the chairpersons of our specialized societies, and they talked about a whole lot of things, because those who formed the panelists were critical care nurses, perioperative nurses, we had mental health, and we had emergency nurses. So they formed the panel and they gave us a good picture of what is happening in our healthcare system today. And of course, they talked about the challenges, and I'll try to reiterate some of them. I did a Facebook page, my private, personal Facebook page this morning, and a post came through. It said, yes, today is Nurses Day, but of course our P's and I's and the conditions of service, our collective agreement is very important. And that we have seen some politicians throwing money out there. It should be enough to pay for some of the items within our conditions of service. I just read it and smiled and said, this one, I'm happy today we have some of the key players in health here. We have our own Nanaoye, Deputy Chief of Staff here. We'll put across some of our issues, and I hope you can pick them up and have them addressed for us. So today being our day, we know our nurses are also all ears to know what is happening with our general conditions of service, and more importantly, how far we've gotten with the implementation of our collective agreements. I know it is paramount for all of you and for us as leaders. One thing I can tell you for sure is that we are not sleeping on our job. We are following it keenly. We've had several meetings at the Ministry of Health. We've had meetings at the Ghana Health Service where CHAG was represented. We know the Minister of Health has met with the teaching hospitals, the CEOs of the teaching hospitals. I was here at my office when the Dean of the CEOs popped in. He just passed through and just came to tell me that the minister has engaged them, they are ready to implement and all of those things. So the effort is ongoing. I cannot tell you for certain when it will be implemented, but what I can tell you for sure is that we are following up. And as a trade union and a professional association, we are ready to take decisive actions if we think that the delays become unduly delayed. And that assurance I can give you. Because we know where our mandate comes from. Our mandate comes from you, the members who have voted us into office. And we have no excuse but to continue pushing for better welfare conditions for all of you. And that is what we have pledged to do. distinguished invited guests, ladies and gentlemen, our nurses and midwives are working in very challenging environments where, I'm going to list a number of them. Our colleagues are demotivated because our working conditions, including our monthly remuneration, is not the best, and most importantly, our collective agreement signed with the employer as far back as May 2024 has not yet been implemented. And the assurance I've given you, we as leaders will stick to it. We are going to engage as much as we can to have it implemented. But if it continues to delay, like I said, we know what to do. Some of our colleagues have also emigrated, seeking greener pastures elsewhere. And it's all because they complain that their pay is not good, the working conditions are not the best, they need equipment to work with, they are not there, so they've left. And once they have left and they have not been replaced, what we have is increased workload. And where there's increased workload, the resultant effect is burnout among some of our nurses and midwives. And the solution is simple. We need to find a way of ensuring that we ethically manage migration, and in fact change the current 3 levels of our training, which is auxiliary, diploma, and BSc, to just BSc entry in our education. It will help a lot of us to gain specialization as quickly as possible, and at the end of the day, is the Ghanaian population that will benefit from it. Nana Chairman, we are still grappling with lack of basic equipment to save lives in our emergency units. Sometimes there's great difficulty when you know you are working with an oxygen tank or you are working with one equipment or the other, and you have to take that decision to move it to this patient or to move it to that patient because we don't have enough of those equipment in our facilities, and most especially our emergency units. And sometimes I say to my close friends and family members, look, in Ghana here, when you get sick and you know you are sick and can be driven to a hospital or you can walk there yourself to seek care, thank God. Because usually when you get into emergencies where you cannot speak for yourself, to even introduce yourself, that in our case that even I'm a nurse, I work at this facility, or I'm a member of parliament, or I'm the head of this facility, you may find yourself wanting in terms of the care that may be given to you. And it's not as if our professionals or our practitioners don't have the necessary knowledge and skills to do it. They have it. But they are challenged with the equipment they need to do some of these things. And providing medical care is not just about using our hands to touch, to pick, and to do stuff. You need equipment that will actually assess your patient, tell you the oxygen saturation in the blood. You need to be able to have oxygen to sustain breathing. You need a whole lot of things. And in most cases, in our emergency units, these equipment are missing. And we need, the solution is simple. We need more investment in health. More investment in health means that we are getting more of these equipments in our health facilities to sustain lives, prevent further aggravation of health conditions. Nana Chair, ladies and gentlemen, we know that the budget allocation for health runs somewhere around 8 to 10%. And it's been like that for so many years. The Abuja Declaration that was signed by our West African governments in 2001 sought that governments will apply at least a minimum of 15% to health. And this 15%, in the view at that time in 2001, could sustain, ensuring that we have enough equipment, ensuring that we pay our practitioners well, to be highly motivated to work. But we have not been able to attain that level as a country. And it's not only Ghana. Most countries within Africa are not there yet. But we think that Ghana, as the gateway to Africa, can do more. We can do more and move beyond even the 15% to 30%, which will allow us to do a lot of investments in health, refurbish our old facilities, build new ones, ensure we have adequate equipment, and then our practitioners will be happy to work in such environments. We also lack medicines, essential medicines in some of our working areas, and our midwives will tell you it's not easy sometimes. And we need, once we solve the issue of the investments and also ensure that the National Health Insurance levy is reimbursed to our health facilities on time, enough resources will be available to ensure that we have these things. The buildings we work in, like I've already mentioned, in some places it's an eyesore. Water supply is a great difficulty. Water. You are working, you know infection prevention requires you to wash your hands severally. When you wear your gloves and you remove it, you are supposed to wash your hands. If you care for this patient and you are going to the next one, you are supposed to wash your hands. If you pick one item, washing of hands is a continuous effort to ensure that we don't transfer organisms from a surface or from one person to the other. But in some of our facilities, water supply is a great challenge. They are buying water in tanks, buying water. And the revenue you generate as IGF, how long can it sustain buying water, paying for electricity, and all of those things? We need to look at these things and ensure that we have adequate water supply in our facilities, we have adequate sanitation in terms of our toilet facilities, and to ensure that the general hygiene in our facilities are the best. I was on one panel the other day, and one of the panelists said, if you enter a health facility, it should be like you've entered a hotel. And we deserve that, isn't it? Yes. We all deserve it. And we go to UGMC and we are very happy because the services are what? Top notch. The facilities in which you will sleep or be taken care of is good. We believe our health facilities can all become like that. Our teaching hospitals have been there for decades. Serious renovations are needed. We need new hospitals to be built with modern day equipment that takes into account to be sure that it's climate friendly and we are able to dispose of our used consumables properly, such that we don't destroy the environment and ensure that we keep our climate safe. We have facilities where if you have to do medical investigations, most of the time you have to step out and go and do it. A patient comes in, is ill, that same patient needs to step out and go and do these investigations and come back. And when I talk about patients, we are not exempted as professionals. So we ourselves experience it. And in some cases, when the patient is in coma or is unconscious and you have to move, it becomes very dangerous because the transportation from the bed to the ambulance to that facility and back becomes something else and poses a risk to the patient. It's about time we improve the equipment and have these portable investigative equipment in our facilities. They are wheeled to the bedside, you do it, it reads, you are able to diagnose and manage your patients. Our colleagues who are serving in rural areas, underserved and deprived areas, are demotivated. They are demotivated because they think we've forgotten about them. In some of the employing agencies, if they apply for study leave, what they tell them is that, look, if you go, we cannot replace you. And sometimes they tell you, wait, when we have replacements, then we can give you the study leave to go to school. Is it fair? It's not fair. We believe that if our colleagues accept posting to these rural areas, the maximum they should stay there should be 3 years. 3 years they should be moved to urban areas and others also sent there. But within the 3 years, they should also be highly motivated to be able to stay there and continue providing health services to the people in those communities. And motivation means that we have talked about this over and over again. Some rural incentive package for them will not be bad at all. A minimum of 20% of their monthly earnings should be good. They should be able to go to school early in terms of granting of their study leave. They should have early promotion, and all that, so that they can be highly motivated to work. How many of you here will accept posting to a rural or underserved area? How many of you? I'm not seeing any hands up. It means that if your condition should change today and you are going to be posted there, you will say, I'm sorry, I cannot go. We know the circumstances under which some of our colleagues are working. It is not easy. And it's a blessing that they accept postings there and they are working. So we must also ensure that their circumstances are good. Our rotation nurses who have worked for months are also not getting their internship allowance or rotation allowance. It is a big issue, and it's important that we look at it and address it. I hope that our guest of honor today will take it up for us. They need to be paid their allowances. We also have our unemployed nurses who are waiting to be employed. The fact is that some of our colleagues have retired, some have traveled. The gaps are there. We know some employment was done, or recruitment was done in December last year, but it's still not enough. It is still not enough. And we need to employ more of our colleagues to come into the public service and support the management and care of our patients. Because indeed, public services is what provides access to populations. There are majority of us who cannot access private health care because it's expensive. It's expensive. So we need to continue our advocacy and support governments to be able to provide what it takes to make our public health services better, so that we can all make use of them. So it is therefore critical as a nation that we focus on the enormous potential that strategic investments in nursing can have in generating economic and social progress in Ghana, and not only Ghana, in Africa and across the world. Because nurses continue to form the majority of the health workforce. And that is why the DGs of the Ghana Health Service continue to call me majority leader in the health space, because we form the majority. And the current DG says, if I'm the majority leader, then he's also the majority employer, because he employs most of these practitioners. If we have to attain universal health coverage and the targets of the Sustainable Development Goals, especially the Goal 3, then it's important that we continue to invest in our nurses, in our midwives, and see it that we gain economic impact. And the economic impact is way beyond the value that governments have placed on it over the years. But it's about time that narrative changes. And we hope and pray that with this International Nurses Day, we can continue our advocacy on those lines and ensure that our current government invests more in health and, of course, in our nurses and midwives. We are also challenged with some level of violence in our health facilities from our patients, from our patient relatives, and sometimes from our colleagues. And based on this, I want to use this opportunity to call for the ratification of ILO Convention 190, which will help safeguard our health workers, not only health workers, but workers in general. So let us with one voice continue to call for investment in nursing to ensure adequate numbers of well-trained, well-paid nurses, labor and trade union rights for nurses and midwives, zero tolerance for violence in our health sector, and insist that governments and employers respect that nurses and other health workers are not targets for anything, but then we are there to work and provide the care that our knowledge and skills can support. So, on this note, I want to end my welcome address by saying that You are all warmly welcome to the GRNMA headquarters. For our colleagues who have joined online, I equal to you for the great work that you do and continue to do. We'll continue to lead as is required of us, and your role is to also being responsible members of the association and supporting leadership. At any point in time when we call on you, we hope and pray that you also respond to our call. Thank you very much for listening, and let me give you one last showboy. Showboy! Thank you very much.
Thank you.
Wow, I feel good.
Oh, we can do it better. We can do it better. Thank you so much.
Feel good.
And that was our president, Mrs. Perpetual Ofori-Ampofo.